Okay, here we have a 7-year-old, 2-month female that has had a pulpectomy and a stainless steel crown placed on B. So what I'm trying to do today is just show you a technique that I use. Now, this little girl is a fairly anxious patient. I talked with mom. We decided that, well, I never talked to the kids about giving them the shot. You know, if they recognize the fact that I'm going to use something that looks like a needle, I'll tell them I just have to get this stuff real close. And if they move, they're going to poke themselves. Now, we're not holding this little girl down or protecting really much of anything. Put in some super topical and let that sit in there for 30 seconds or so. And then I use kind of a shake and squeeze technique, blocking the long nerve endings or whatever, you know. So, but anyway, it's just a technique I've been using for the last 20 plus years, and it seems to work. It distracts the patient, just the shake. So what I'm doing is I'm using a 30 gauge short. That's kids for infiltrations and irrigating out hot endo teeth. I'll use a 30 gauge. I never use a 30 gauge to do an inferior alveolar block or anything. Big discussion right now on the Dental Town threads about use of a 30 gauge, and Malamed definitely says it's contraindicated, and so for whatever that's worth. So I've anesthetized, done an infiltration on the outside, and I'm going to let a minute or two go by, just let that take effect. Now, if you'll notice, looking at this little girl, you haven't seen her wince or jump or flap around or any of that stuff. You see a little exudate coming out of that area. But what I'm doing now is I'm trying to go through the interproximal, and we're looking to see if we're getting any blanching on the palate. I'll ask my dental assistant as they're blanching, and she'll watch for it, and she's telling me, well, it's halfway or whatever. And so I'm just going real slow. You know, we're into this recording right now. It's about 2 minutes and 40 seconds. So I'm not getting into a hurry. I'd recommend you not get into a hurry. My focus is not on kids. You know, it's not that I don't like kids, but you know, if I had my druthers, I would work on adults. But here, this little girl, 7 years old, very anxious about everything. I think she's doing pretty good, you know, because we're just talking to her and being, you know, hey, don't move, you're going to poke yourself, that sort of thing. And so she's staying real still, and everything's working. But we went through and did everything we possibly could to minimize her feeling anything. Anesthetize the buccal, allow that to set, and then go in interproximal. You can see that some exudate coming out of that big puffy tissue there. So on kids, I don't use elevators. Just don't do it. There's no reason to. I'm going back in. I looked at the x-ray and I could see that there's kind of a furcation area, so I just went back in and I'm trying to get some anesthetic into the furcation. Like I said, I don't use elevators on kids. I think it's unnecessary. You also want to take care that you don't use, say, a 23 forceps. You know, try to pop in between a furcation. You know, the furcations on kids' teeth are usually pretty huge, but you don't need that kind of force. And then you've got an adult tooth that's up underneath there that you may damage. So what I'm going to do in this case is I use a 150 forceps. I've allowed some time to go by. Now at 4 minutes and 50 seconds into this process, you know, I'm checking the tissue, making sure everything's going a-okay. Notice I put a finger on the pallet, I put the thumb out on the buckle, I engage the 150 to start working it, a little wiggle in here, boop, there goes the stainless steel crown, get rid of that dude, make sure we got that out of there, go back in, grab onto the tooth itself, and wiggle in it, and then go back to the pallet. You know, we talked about breaking buckle plate, that's kind of the movement. Anyway, look and check and make sure, then we start talking to her about